Welcome to the Environmental Justice Lab. I am your host, Dr. Leslie Joseph. Thank you so much for joining me. So May is Mental Health Awareness Month, and so all month long, we are talking about the connection between environmental racism and injustice and mental health. The next couple of episodes, we're going to be talking about toxic contamination on your mental health. And for this episode, we're going to talk specifically about lead contamination. Now, we all know, we've all heard about lead, how damaging it can be, particularly for children and particularly as they're developing. But I want to highlight in this episode that lead contamination, lead exposure also has very damaging mental health implications as well as physical health implications for children and for adults. We cannot ignore the reality that being exposed to lead at a young age continually has very damaging effects on your mental health as you're growing and developing and into your adult life. And so on this episode, we're going to talk all about that. We're going to talk about what lead does to you as a child, your mental health, and what it does to you as an adult for your mental health as well. So we're going to talk about that on this episode. Stay tuned. This is the Environmental Justice Lab. Welcome to the Environmental Justice Lab. I'm Dr. Joseph. Thank you so much for listening. So we're talking about the effects that lead contamination and exposure can have on your mental health. And let me just start with these two important ideas. First, there is no safe level for lead exposure. None at all. The moment you detect lead in your environment, there is a problem. There is no level at which you can be exposed to lead and it be okay. The Centers for Disease Control and Prevention, the CDC, they recommend that you take public health action when a child's blood lead level is at 3.5 micrograms per deciliter or more. The EPA says when you get to 1.5 micrograms per liter in your water supply or any kind of exposure, it's time to take action. And just so you know, those are very, very, very low levels. And so that is one thing we have to remember. There is no safe level of lead exposure. If you hear or read about a situation where children are being exposed to lead, it is a big, big problem. And the second thing I want us to think about is the fact that lead contamination is still a major problem in the United States and across the world. It is still a big issue. There is still lead in our environment, and it is still causing damage to children and adults alike all across the world. So UNICEF put out a comprehensive report in 2020 about lead contamination across the globe, and they said that 1 out of 3 children around the world have blood lead levels at or above 5 micrograms per deciliter. Remember, we said CDC says 3.5 is that limit before you start taking action. This is 1.5 times higher than that, and 3 times higher than the EPA action level limit. And they're saying that 1 out of 3 children all around the world have lead in their blood at this high level. That's over 800 million children across the world. And when they did this report in 2020, they found that in the United States, even though we have in the United States, the lead and copper rule, we have increased monitoring, increased awareness, all these things around lead. There's even a Lead Pollution Prevention Week where we raise awareness about lead contamination. Even with all that awareness, this report found that between 125 to 269,000 children in the United States have blood lead levels above 10 micrograms per deciliter. CDC says 3.5. Children in the United States, 10. And globally, the estimates of children with lead in their blood at 10 or higher is between 150 and 575 million. And even in high-income countries like the United States, where the blood lead levels have decreased over time, it's still a big problem. There are so many ways that lead gets into the environment and then gets into the children who are being exposed to it. So even though the blood lead levels in children have decreased a lot in some of these high-income countries like the United States, since we phased out things like leaded gasoline and lead paint, it's still a big, big issue in our society. And when we talk about these lead levels in children, it's important to recognize that these numbers are not spread out evenly across the country or across the world. There are definite disparities based on race and income that lead to some children having much higher levels of lead in their blood and others having much less. For instance, there was a 2020 study in Milwaukee that showed that in predominantly low-income census tracts and in predominantly non-white census tracts in Milwaukee, the children's blood lead levels were greater than or equal to 5 micrograms per deciliter. That's still way above the CDC limit. And they showed in this study that low home ownership, poverty, non-white population, if your census tract had those characteristics, you were 60 to 70% more likely to have higher blood lead level in your children than in other majority white, low poverty, high home ownership census tracts. And so this research showed that these social and economic determinants produced inequities in the degree to which the children were exposed to lead in their environment. And another study showed a clear disparity in race when it came to children's blood lead levels. So when they looked at white versus non-white children in this study across the United States, and they corrected for things like smoking, for poverty, for housing, for education, and they just looked at the racial makeup of the children who had elevated levels of lead in their blood, they found that the black children had much, much higher levels of lead in their blood. And so this is why it's so important to think about this issue with an environmental justice lens, because we can't just look at the data and the statistics and just say, wow, look at all the children with lead in their blood, we should do something. We have to recognize that there are disparities and there are inequities in the ways in which children are being exposed. And as a result, there needs to be interventions that recognize that and engage that appropriately. And so these are some of the things that we've seen in the research as it relates to how pervasive and how damaging lead can be. And so where's this lead coming from? How was the lead even getting into the blood of our children? And so there's several different sources. I wrote them down. There's lead in the water because we still have lead piping in our country. There's lead from industry. So batteries, trying to recycle, mining, hazardous waste facilities. There's lead paint and gasoline. Of course, we've gotten rid of those, but there's still a legacy of that in our environment. So if your house is older, you will have probably lead paint in that home. I think 1978 is the year when they officially banned it from new construction. So if your house is older than that, I promise you there is lead paint in your home, which is a problem. And most of the older homes are inhabited by our non-white members in society, our low-income families. And so they're the ones being exposed to that lead paint. And there's lead in various toys, various cosmetics, and other consumer products that I know there's legislation trying to get it removed, but if you use these products, you will be exposed to lead at very, very high levels. And that's just in the United States. So when we think about globally, you have those issues along with the fact that when we try to discard our old lead batteries, you can think about batteries you put in your toys, batteries from your car, from your vehicles. These types of waste usually end up in other countries far away from the United States with less regulation, less resources to really handle the situation. And so that lead becomes a problem for the people that live in those areas. We have bad recycling activities where lead is leaching from the facilities into the water and into the soil. We have landfills that aren't well regulated or well constructed to keep the lead contamination out. And we have infrastructure that doesn't have the capacity to actually deal with so much waste and so much of what's been discarded. There's dust everywhere. Sometimes they're burning these batteries and burning this lead in open air dumps. So much contamination and so much is being emitted all across these areas that the local inhabitants, the people who live near these facilities, near these dump sites, are being indiscriminately poisoned by this lead. And it is such a problem. And that's why you're seeing so much lead in so many children all around the world. And let's remember, lead directly causes mental health issues for children and adults. Let's not forget, it's Mental Health Awareness Month. Lead directly is responsible for mental illness in children and adults. The research is out there and we can find it, and we know for a fact that this is the case. So let's think about how that happens. We know that lead is a neurotoxin. It damages your brain. And that's the worst thing that can happen as you're a child developing and growing and trying to learn. And so all the studies will tell us that children, especially who are exposed to lead at young ages, will have learning issues. They'll have lower IQs. They perform worse in school. They have difficulty paying attention and following instructions. And their growth is delayed. Their development is delayed. There's so many issues that happen when a child has been exposed to lead consistently and has elevated levels of lead in their blood that we can detect and see. These are some of the things that happen to that child. But we can go a step further because there's even more significant mental health issues associated with lead exposure. The research is clear. Children who have elevated levels of lead in their blood experience more major depression, more mood disorders, and attention deficit hyperactivity disorder, or ADHD. And they've been able to attribute and associate those disorders with children with elevated levels of lead in their blood. They found that these children also have deficits in their cognitive abilities, that they have memory loss, they have impulsive behavior issues. And in many instances, they found that children who struggle with substance abuse and criminal behavior have high levels of lead in their blood as well. Another study has found that juvenile delinquency and violence and crime have been associated with preschool lead exposure. So all of these things are taking place because of the ways in which they've been exposed and the degree to which they've been impacted by lead contamination in their environment. I read one study where they attributed high levels of lead to increased heroin use among residents in Baltimore, Maryland. There's a study that shows that. We can't ignore the fact that along with the physical health issues that go with lead contamination, there are serious mental health issues that come along with it as well. And when we think about lead exposure and the issues that come along with it, we typically think about the children. I mean, they are very important. They're precious. We don't want anything to happen to their development and their growth. And so we're concerned about them being exposed to lead because it's a big problem. But we can't ignore the fact that these children become adults. And as adults, they also experience significant mental health issues because of their exposure to lead in their environment. So I said earlier that we've gotten rid of, lead paint. We've gotten rid of lead gasoline. We see the issues, particularly in the United States, and we're trying to get lead out. But if you were growing up with all this lead around you, and now you're an adult, you have to be mindful of the mental health implications of your exposure. So researchers are telling us that in the late 70s, in the early 80s, when lead was at its peak in our society, in our environment, the average child in the United States had blood lead levels of 15 micrograms per deciliter. That's 4 times higher than that CDC limit of 3.5. And so when we think about lead exposure being a problem for children, now we know that there's some serious mental health issues when you're an adult. For instance, a 2013 study in the Journal of Neurotoxicology found that adults who had elevated blood lead levels when they were children were associated with lifetime diagnoses of drug and alcohol abuse, social phobia, anxiety, and antisocial personality problems. And there's a bunch of studies that are linking elevated levels of lead in your blood as a child to adult diagnoses of schizophrenia and psychosis. This is serious. Schizophrenia and psychosis. Now, I didn't even know that part, so I had to go back and look and see what we're talking about. So, schizophrenia is a mental health disorder that includes symptoms like hallucinating, paranoia, and distorted perceptions and views of reality, all stemming from potentially having high levels of lead in your blood as a child. The National Institute of Mental Health says that people with psychosis typically experience delusions where they believe things like there are people on television sending them private messages, and that people are trying to hurt them, and they hear voices, and they don't know what's going on around them. Like, these severe mental health illnesses are being linked to elevated levels of lead in your blood when you were a child. That's how bad it is. That's how serious this kind of contamination can be for individuals. And when you think about the reality that there are some in our society who experience this exposure, this contamination, this lead poisoning at much, much higher rates than others, and when you think about what the impacts can be, we have to look differently about what we're seeing when it comes to behavior, when it comes to our mental health, our physical health. All of these things need to be considered in light of these types of exposures and these types of toxic environments that people are living in. We have to be aware of that and be mindful of the fact that if we see a child acting out, a child misbehaving, a child recklessly making decisions that are hurtful and harmful, maybe it's the environment that they are living in. Maybe they're surrounded by toxic chemicals and contamination, and that their mental health is being grossly and severely impacted by that reality. That cannot be ignored. We cannot just sweep that under the rug and just assume it's something else. And they're still working on the research. Every article I read, there's gaps in the data. There are gaps in our understanding. There are gaps in what we're trying to understand about these situations and how they're related to contamination in our environment. Each year, each study, we're learning more and more because it's such a big problem, not just physically, but also mentally. We have to be aware of that. And so just to summarize what we've just talked about, for children, being exposed to elevated levels of lead can lead to so many health issues, mental health issues, major depression, mood disorders, ADHD, criminal behavior, substance abuse, delinquency, crime, violence. All of these things, our researchers have shown us that there's a connection between having large levels of lead in your blood as a child and these kinds of mental health issues and disorders. We can't ignore that. And for the adults, being exposed to elevated levels of lead as a child can have so many health issues, physical and mental. Things like drug and alcohol abuse, social phobias, anxiety, personality disorders, schizophrenia, psychosis. The researchers have shown us all these things. This is what can happen to an individual who is exposed at high levels or for a long time to lead in their environment. And then we have to consider where these elevated levels of lead can come from. Where are they found? Let's just be honest about that. Black communities in the United States, low-income communities in the United States, brown communities in the United States, places where you have old housing, old piping, places where you have poorly ran, poorly regulated disposal facilities, dump sites across the world that aren't managed well, that allow for lead to get into the environment, into the air, into the soil, into the water. More lead contamination, more lead poisoning, over and over and over. And so we have to recognize that along with the negative physical health issues, lead contamination can lead to severe mental health issues that can persist long past your developmental childhood years. It doesn't stop when you turn 18. It can continue to persist. And if you experience a mental health issue, a mental health crisis, and you believe that you may have grown up in an area, in an environment that was full of this kind of contamination, it can't be ignored that that may have contributed to that outcome that you're experiencing. It cannot be ignored. And so we have to be very careful how we judge others, their behaviors, their mental and physical states, and particularly those children who are marginalized and who are vulnerable, who are minorities in our society. Where did they grow up? What was their physical environment like? What were they exposed to? And how did that have an impact on their mental health and their mental well-being? It's an open question that we have to be honest about when we answer. The researchers are telling us that there is a connection between lead contamination, lead exposure, and severe, serious mental health disorders. And we can't ignore that. And we can't continue to allow our children to be exposed to these high levels of lead, no matter where they are, or no matter where they live, no matter who they are or what they do. We have to continue to work to get the lead out of our environment, because this is just another indication of how damaging it can be and how harmful it is to have that lead exposure consistently as you grow up and to see the fallout as you enter into adulthood. We don't need that, and we need to find ways to get the lead out of our environment. It is that serious. And that's it. That's our episode. Thank you so much for listening to the Environmental Justice Lab, where we are for the people and for the planet. See you next time.